Good morning. It's Friday, July 22nd, July 23rd. I'm Jessica Lovell. Welcome to the Morning Medical Update. In just a few moments, we're going to get to our latest COVID numbers and vaccination recommendations from the CDC Advisory Committee on immunization practices. We are also talking about COVID and the Olympics. The opening ceremonies are just now underway in Tokyo, where 2 area gymnasts are stuck in quarantine. We'll hear from 2 of our doctors who work with elite athletes and the impact of athletes testing positive for COVID during this very special time for them. So a lot to get to this morning, but first, Chief Medical Officer Dr. Steve Stites, of course, joining us with our COVID count and a few words to get us started today. Good morning to you.
Hey, good morning. So let's take a look at those numbers, which are pretty stable today. We have 56 total patients, 33 active infections. We have 23 additional patients who have been here for a while, what we call discontinuation criteria. We have 12 people in the ICU and 7 on ventilators. So still a pretty big number, and actually way too big of a number. You heard us say yesterday that it may be time to think about masking up again. And one of the things we wanted to stress was the reason that's so important is because, well, to borrow from Star Trek, I know I haven't made a reference this week, so I had to do it.
Let's do it. It's Friday.
When trouble comes, shields up. When trouble comes, mask up. And right now, trouble's here with the Delta virus. Interesting discussion going on nationally. Do patients who are vaccinated need to wear masks? And I think the consensus is this. The Delta virus is so much more transmissible than the original coronavirus. The original coronavirus, remember that R naught we used to talk about? Remember R naught we said was how likely is one person to infect other people? And the answer was, it was an R naught of around 3-ish, 2 to 3. The projected R naught of the Delta virus is 6. It is so much more infectious than the original Wuhan virus. So the concern for those who are immunized is, first, if you are around a group of people and you're all been vaccinated, you're probably fine. But if you're around a lot of unvaccinated people, there is a good chance that you could still get the Delta virus and you might transmit it. We don't know what that likelihood is, and that's what's making everybody just a little nervous. We're not sure, once you've been vaccinated, how much of a vector you can be. But if you, as a person who may have gotten it, even if you're vaccinated, you're probably going to be asymptomatic, then the concern's going to be, can you transmit it to someone who hasn't been vaccinated? And again, this is the pandemic now of the unvaccinated. The risk of death, once you've been vaccinated, has dropped dramatically. We know that. We know that of the deaths currently occurring with this version, with the Delta coronavirus, that nationally, only about 1% are in vaccinated patients. 99% are in unvaccinated patients. The risk of hospitalization and death drops dramatically. Nationally, only about 3 to 5% of patients who are hospitalized have been vaccinated. 95 to 96% are unvaccinated. There is a message here. The risk of hospitalization, the risk of death, it goes down dramatically with vaccination. But we have to still take care of each other, and that's why you see people saying it's time to go back to masking. Chicago Public Schools announced today, masking in session. So you're seeing it across Los Angeles County has said, masking. And you just look at the maps here in the area and you get a little nervous about what's going on, and you start thinking, as an individual, regardless of what government says and political leaders and things like that, I'm not trying to discount. They have a very hard job. They got to walk a lot of lines. They got to maintain a good balance. But as an individual citizen, as a member of our community, as somebody who wants to help take care of others, what's the right thing to do? I think the right thing to do is be on the defensive. Shields up, masks up. Let's take care of each other. Let's keep coronavirus out of the door. Let's break the curve. Get vaccinated, wear your mask, break the curve.
Good words. Thank you, Dr. Stites. Okay, we want to bring in Dr. Kevin Ulm. He's an OBGYN here at our health system and member of the CDC Advisory Committee on immunization practices. The committee met yesterday, Dr. Ault, to talk about vaccine benefits and risks, the J&J vaccine in particular. Tell us what you learned or what you decided on.
Well, this was an unscheduled meeting. We do have unscheduled meetings when we have something to talk about as far as emergency use authorization or safety signals. There is a safety signal for the J&J vaccine or Janssen vaccine as far as an excess reporting of Guillain-Barré syndrome. So Guillain-Barré syndrome is an ascending paralysis usually caused by an autoimmune or infectious cause. Influenza can cause it. There are a variety of gastrointestinal things things that can cause it, infections that can cause it, COVID can cause it. So, and it's known in some flu years that there's an excess of Guillain-Barré due to influenza vaccine, although influenza causes it more often than vaccination causes it. And so you can see on our graphic here, based on our data, there were going to be 3 excess cases of Guillain-Barré. Based on the first pass this data, I'm guessing this number might go down, actually. So, I'm sorry, 7.8 extra cases of Guillain-Barré per million doses. The background rate is about 10 per million people. So, there'll be a slight excess of this serious disease. And so this slide kind of looked at all the meetings we've had recently. The TTS, the thrombocytopenia plus thrombosis, is a low number, but a serious disease similar to Guillain-Barré. This is only adults, and the myocarditis risk from the RNA vaccines, as you can see, is 3.5 per million doses. So these are extremely rare, but potentially serious side effects that have been identified.
So for people who are concerned about getting the vaccine, what does this tell them?
Well, all of these things can happen more frequently in COVID, all 3 of those things we just mentioned in COVID than they would from the vaccine. So that, the take-home message is to go ahead and get vaccinated. Right. But, if you have anything that happens the first week or 2, which all of these things seem to happen pretty promptly as far as chest pain or concerns about leg swelling as far as blood clots go. I had a relative that had Guillain-Barré, and I remember she said she couldn't push on the brake of her car was how she noticed it from her ascending paralysis was the first thing that she had. And so, anything that's funny, especially that first week or 2, you want to call your doctor, basically.
All right, so stay close because we're going to have some community questions for you for sure.
Well, we also talked about boosters,
okay,
which I think was on last Friday.
Yes, let's talk about that. So. We got a lot of questions about that.
Well, there are beginning to be some data that in immunocompromised patients, which is about 1 to 2% of the American population. It's a pretty heterogeneous group of adults and children. It's organ transplants, people getting chemotherapy, people with advanced HIV disease. There are some data that the vaccines are less effective in that group. There's also some data, and I'm looking at my notes here. So there were 4 studies we looked at that in people that did not respond to the first 2 doses had a measurable antibody response after a 3rd dose. So people that have had 2 doses, no antibody response in this 1 to 2% category, and then had a 3rd dose. And in those 4 studies, it was 33 to 50% of them had an antibody response. And so the question is, should we be recommending a booster of these vaccines in this very narrow population? The problem that we kind of butted up against is that we have an emergency use authorization for these vaccines, which is very restrictive about how we use them. Doctors will prescribe medications for off-label use. I'm a gynecologist, so for years we gave oral contraceptives as a treatment for painful cycles, even though that was an off-label use. But oral contraceptives had been approved. The usual mechanism for vaccines to be approved in the United States is called a biological license application. And it's probably still going to be a few more months before we get that version of vaccine approval and we can do these off-label uses. We also need some data about if getting that 3rd shot helps protect people against COVID. One of the members, Dr. Talbot from Tennessee, actually said pretty much exactly what you said a few minutes ago. If you have somebody in your family that's in this 1 or 2% category, you should be getting vaccinated to protect your family member if somebody goes to your church or your temple in that situation. And you don't always know, of course, if somebody's fighting chemotherapy or has a long-standing kidney transplant. And so, she really emphasized that we, masking and social distancing and vaccination of people that come in contact with these people in this special category really needs to happen.
I think, when the CDC backed off the masking mandates a number of months ago, we didn't have the Delta virus, really.
Right.
The Delta virus has changed the story because it is so much more transmissible. That's what should be making us afraid. If we were still dealing with mostly the original Wuhan variant, I'm not sure we would all feel the same. But the Delta virus is a game changer. We have to respond to that because otherwise what happens is unvaccinated people are at risk. And maybe people can be frustrated with someone who's decided not to get vaccinated, but frustration is not the answer here. The answer is we have to take care of each other because, again, we know the answer. Vaccination plus masking equals success. And what we want is for people to be okay.
Reporter questions on the line. I think Cody's on the line with us today.
Cody.
Hey, good morning, everyone.
Good morning.
Question for Dr. Ault, since he's here. You know, one of the biggest defenses I hear from people who aren't vaccinated, even people in my family, say, well, you know, it's this experimental vaccine. I'll look at it again when it gets full approval. You're the guy to ask. What's the timeline on that right now, and do you think that that will help boost the numbers?
That came up yesterday, and we have somebody from the FDA, Dr. Fink, who represents the FDA to our committee, and he said sometime in the next few months. You know, there are a lot of time demands on the FDA right now because we want them to approve shots for children. We want them to look at these third vaccinations. You know, we want the BLA approval for these vaccines. So I would say they are certainly not experimental. Tens of millions of Americans have received these vaccines, and that's why we're able to find these very rare potential side effects. So, you know, trying to keep abreast of the publications is like drinking from a fire hose right now. So there's something in the New England Journal of Medicine today that says the vaccines work against the Delta variant. So we have lots of experience, lots of publications, lots of safety data about these vaccines. So I don't know that I would let that keep me from getting vaccinated at this point.
But do you think what kind of impact do you think the FDA approval will have on the unvaccinated and their thoughts about
getting it? Are you around your kids when they give you a reason they don't want to do something, and then when that reason doesn't exist anymore, then they got another reason why they don't want to do it?
I have no idea what you're talking about.
I have a feeling that this
is called moving the goalposts.
Yes.
So, yes.
Yeah,
so.
I bet that's what's going to happen. I think there will be a portion of the population, once it's FDA approved, say, okay, I need to get it. But I think there's a portion that's still going to be in denial.
Well, I mean, you talking about R0 at the beginning, you know, the Delta variant is going to take a lot higher vaccine coverage because of that increased R0 to stop community spreads.
Well, originally we thought with the Wuhan variant it was about, 65 or 70%. Now it's 85% is the number we have to be vaccinated. So that's a lot bigger number. And you know what? As long as we don't get vaccinated and we let these variants develop, we give more money. We're going to have to keep pushing that number up more and more. And the answer is just help us break the curve. Get vaccinated, wear a mask.
Other questions?
Yeah, one for Dr. Stites here. I know yesterday you were on talking about mask mandates, and the chief medical officers had talked and said, you know, we're comfortable with recommending this. It's become such a political issue, as you know. Will leaders heed this warning? Because I'm seeing many places strongly recommending it, but not pulling the trigger and requiring them again.
Yeah, Cody, that's a great question. I don't have an answer for that. Chief medical officers live in a world characterized by, right now, no beds, a lot of full hospitals, and concern about how we're going to take care of all these COVID-19 patients. So our answer to this is going to be, gosh, let's get mask mandates going. The political leaders have to say, what about businesses? What about all these other things? And I'm not a political leader, and I'm going to just say, from my standpoint, we need to be masked because I think we're under siege by this Delta variant, and I know we are. And you can see it. One of the things I was talking to one person last night, and they're like, we're not seeing it in Wichita so much. And I'm like, right, because there's no highway from Springfield to Wichita. You watch that. It's 2-lane roads. It's a hard drive. I used to make that drive a bunch. It's hard. But there's a couple of big highways between Kansas City and Springfield. And if you go back to the origin of this whole thing, if you remember those original maps where we were trying to figure out the spread, remember it was along highways. You could map it. If you mapped I-70 or I-80, you could just see how the virus was going out and spreading. I think that's what that's what happened with the Delta virus too. So we're just watching it crawl up from southern Missouri because there's a lot of traffic between Kansas City and Springfield, and Joplin and Kansas City, and Joplin and Springfield. So there's just a dangerous triangle right there. So from my mind, my simple mind is, how are we going to prevent it? Well, I think we need to mask up. Do political leaders see that? I don't know that they do. I think it's just they have a different set of circumstances that they have to live in and cope with. What I'm afraid of is that things are going to get worse and worse and worse, and then we're going to be forced to do it. I'd like to do a little prevention so we don't keep things that bad, because I'm afraid what's going to happen with our hospitals and things. I don't want us to see us end up in Springfield. And knowing how full we are and how hard it is to get patients transferred right now, I just think that's a threat to all of us. And that's why I try to get the warning out there. Guys, whether someone tells you to or not, shields up, put your mask on, because it's going to keep you safe along with being vaccinated.
Other questions on the line? Okay, it's follow-up Friday, so we're going to get to our community questions that came in over the week here in just a moment. And then, of course, send in your questions that you have today. Right now, we're going to try to get to those here in just a bit. But right now, we have something to get excited about tonight, and that's the Olympics. Our next doctors both work with USA teams, orthopedic surgeon and head team physician for the Kansas City Royals, Dr. Vince Key. He's an associate team physician for USA Track and Field. And also joining us on the line, Dr. John Ault, medical director of sports rehabilitation medicine, is the team physician for USA Swimming and USA Gymnastics. So no two better guys to be here this morning as we kick off the Olympics. Okay, so Olympic athletes, sometimes they kind of seem like superheroes. They're stronger, faster, just kind of better than all of us average people. So people must ask you both all the time what it's like to provide medical care and work with these type of elite athletes. So Dr. Ault, get us started. What's it like?
It's fun. Bottom line, it's a great time. These young men and women, they've been doing it all their life, especially when they get to this level. They really are so focused and just single-minded on what they need to do and accomplish. It really makes it a good time to work with these young athletes.
Dr. Key, you've got 4 of them out in Tokyo right now. Tell us about that.
4. I was with a team in Mexico 2 years ago, and there are four individuals, I believe 2 women and 2 men on the team, and it's a special time, and these folks have been working very, very hard for years. And I know, being at Kansas State where I ran track, we had 2 Olympians on my team, and just looking from when they started from high school all the way through, and then to get to that level. I know my teammate Kenny Harrison, he was a gold medalist in '96 in Atlanta, and just looking at what he went through, there were injuries. You know, he missed the '92 team and then get to '96, and then he was the American record holder in the triple jump up until about 4 years ago. But it's a grind, and we're there to help them get through that grind.
And doing all this during COVID, I mean, you know, what a challenge. So they're under pressure as it is, then you add COVID. Dr. Key, you know, what kind of stress does that add to these athletes? And what would your concerns be for keeping them safe, whether they're overseas?
Well, I think the big picture is the way the timelines went, because all these guys were training to a date. And then when that date got taken away from them, then they have to throttle back down. They go through COVID, and then they have to try to ramp back up to get themselves ready for another date. And that's the up and down is the grind, because you get fatigue, you get muscle injuries. Christian Taylor, who was supposed to be the favorite in the triple jump, tore his Achilles, so he's out. So it's building up and then throttling back down and then building up again. It's going to be a lot different in Tokyo in terms of things that need to be done. There are some teams that are choosing not to be in the Olympic Training Village, where they're wanting to be in a hotel. There are some teams, I believe, that are actually on an island off the coast and training there, and then they fly back over to the mainland, if you will, to compete. So there's a lot of different moving parts with these teams. I know baseball-wise, I have Bubba Starling over there. I've texted with him a couple of times, and you know, it's with USA Baseball and the things that they have to manage. But it's going to be so different, and it's just trying to get through this time and trying to keep these athletes healthy. It's going to be a humongous challenge.
Dr. Ault, so we've been talking about the 2 KC area gymnasts that have been quarantined in Tokyo. We know one tested positive, was vaccinated. What was your reaction to that news?
I was surprised, you know, again, but as it's been said, the vaccine is not 100% guaranteed, so it is always a risk. I know USA Gymnastics, I just got back with them from the Pan American Championships in June, and that was a hot topic for us, is making sure, basically keeping our athletes in a tight bubble, keeping them away from any exposures as possible. And that's just from USA Gymnastics. Now at this level, the USOC is stepping into it. And again, even once they get in the country, the IOC and the Japanese government, they have a lot of safeguards. So a little bit of a surprise when that exposure happens. But again, that's why we talk about raising our shields. We need to protect ourselves, but our athletes need to do the same because it can happen to anybody at any time.
And safety first, but it must be so incredibly disappointing for these young ladies to be in quarantine after making it all the way to the Olympics. Thoughts on that?
It's hard. I mean, this is, for a lot of these athletes, this has been their lifelong aspiration. Where did it go? And then these two local athletes made it. They were going there, and then this were to happen. But again, they do understand the maturity level of these athletes is also just outstanding. They're fully aware of the risks that are involved. I mean, from whether it's COVID that pulls them out or an injury, they're aware that these things can happen at all times, which is also why the team, we send alternates to go with them just in case something happens.
Well, I think you said it. They made it. So they're still rock stars in our mind. Pretty amazing. We love that. Okay, so Dr. Key, not going to be spectators at the Olympics. We know that's all out of safety precautions. So what kind of impact will that have on the environment for those athletes? We know the spectator aspect is a big part of the Olympics.
I think the big picture here is internal drive versus external motivation. And that's athlete to athlete. There are some athletes that are driven by the crowd, and there's some athletes that just have that internal fire in them. Do I expect there's going to be a lot of world records broken, especially on the track for track and field? Probably not. I mean, there are going to be some individual, great individual accomplishments. But again, it's just going to be the mental aspect. And I know that we have team psychologists and that go with the team. It's going to be a little bit interesting with an autopsy after the Olympics to see how these athletes deal with the fact that there's no spectators there. How do they deal with being in a bubble? These track and field is an interactive type of thing, and a lot of the athletes hang out with each other and do things together. And again, they feed on the crowd, they feed on the adrenaline. So it's going to be really interesting, like I said, the autopsy after the Olympics to really see how these athletes really withstood this.
Great insight today. Okay, so send in all your questions from the community. Send them into all of our doctors today. We want to hear from you. We're going to try to get to those, but I do want to get to some follow-up questions from the week. We had some really good ones. The first one, Dr. Stites, I know you said it. The question was, how dangerous is the Delta variant? Former FDA Commissioner Scott Gottlieb said, because it is so contagious, it will infect a majority of unvaccinated Americans soon. And with 50% of the population fully vaccinated and a third having contracted the virus before, he said COVID will soon run its course.
Yeah.
So do people still need to get vaccinated then?
Yeah, I
Short
think
answer.
Yeah, of course they do. Because the problem is that COVID can infect those who have had, or the Delta variant can infect those if you've had COVID before. I think this quote's been taken a little out of context because Scott Gottlieb was actually being very proactive, saying, gosh, we need to take measures, we need to get everybody vaccinated. You shouldn't think about masks. So if you look at the full story about what he was saying, there was more to it than just that. And I think that's what we were saying earlier. If you look at that R naught, how likely is one person with a Delta virus to infect others? The answer is they're very likely to infect 6 other people. With the original strain, it was about 2 to 3 other people. So they say it is about twice as infectious as the original strain. And so it is a danger, and it is going to be a pandemic of the unvaccinated. And what's different this time is we were so super cautious the first time, and there were a lot of mask mandates, a lot of masking going on, and it wasn't perfect, right? Some areas of the country, people just didn't wear masks, but there were certain, I mean, when you went to a restaurant, you had to have a mask on. If you went into, you had to have a mask on, and that's all gone. So the opportunity for spread is so much greater from the standpoint of people not having masks. Now, there are more people who are vaccinated, and that's the counterweight, and you have to hope that it works. So the question is, how is it playing out? If you go to Springfield, Missouri, or if you go even up here in Kansas City, Missouri now, it's not playing out so good. And that's the real world data that you have to look at. Springfield has a lot of counties around it where they aren't very well vaccinated. But you know what? We're not all that well vaccinated here either, and especially in our surrounding counties. I think I saw some information this morning. I believe, don't quote me exactly on these numbers, but I believe that Johnson County was like 53 or 54% vaccinated. Jackson County is about 39% vaccinated. Pretty substantial differences. And overall, Kansas is 43% vaccinated. Missouri is 40% vaccinated. So that means there's a whole bunch of people who are unvaccinated here in the heart of the Midwest, which is why I think we're kind of the epicenter of this outbreak with the Delta virus. And again, if you look at those heat maps, that's what it looks like. And so I think this is a dangerous time for us because it's so transmissible. There are not mask mandates, and there are a lot of people who are vulnerable out there because they haven't been vaccinated. Well,
what does COVID will run its course really mean?
Well, yeah, it may run its course. The question is going to run over you while it runs its course.
Yeah, right.
So, what does that mean? I mean, yeah, will COVID eventually run? Yeah, it's going to eventually run its course, but how many people will die? How many people will get sick? How many people are going to have long COVID? How many lives are going to be disrupted or destroyed? How many loved ones will you lose while you let it run its course? When we know the answer. Again, we've bent the curve before we had vaccinations. Now we're saying, let's break the curve. If you get enough people vaccinated and you wear masks to protect each other, you can break the curve. And I think that's it. To me, that's the goal. But I sit here in this chair, privileged to work in one of the best hospitals, one of the best health systems in the United States and in the world, and I watch what happens here, and I see what a great job we do. And we don't get people sick inside the hospital because we all have masks on. So I know that they work. And I know that we can keep our people healthy. I know that we can keep our citizens and our community healthy if we just do the right thing. I bet you have some thoughts too, Dr. Ault.
Well, I mean, I agree with everything you're saying. I mean, you know, if it's 40% in Jackson County, you just said, a few minutes ago that it needs to be up to 80%. So that's twice as many people need to be vaccinated in that particular county. And as you said, there's not any county that's doing great. So yeah, I think I agree with everything you just said.
Yeah, don't just run it. It may run its course. Don't let it run over you.
All right. A lot of questions about unvaccinated children. Both of my kids are unvaccinated, so I get this. Is it safe to take unvaccinated children around grandparents with immune health issues? Grandparents are vaccinated. Can kids go if they wear a mask?
You know, I think this is the great conundrum because we don't understand all the dynamics around the Delta virus. My answer to this is what it will always be: just be safe. I mean, if you're a risk, what's your risk tolerance? Are you okay with getting the Delta variant? Because it's quite likely kids can still be asymptomatic, and kids are going to be in schools again as they should be. And so, how does that work? Honestly, I'd say wear masks, but I would tell the kids to wear a mask. I'd tell the grandparents to wear a mask, because if they're immunocompromised and they've been vaccinated, we're not sure, as you pointed out, Dr. Ault, what their response is going to be like. And I think there's a lot of information out there suggesting they may not have as good immune response. They may still be a little bit vulnerable. So given that, I mean, I just say be safe, wear a mask.
Should unvaccinated children be playing outside unmasked with the Delta variant? I tell my kids, enjoy being outside unmasked now because you're putting a mask on when you go back to school.
Yeah, where's Hawkeye when you need him, right? You know, again, these questions ask, in this isolated situation, should unvaccinated and vaccinated kids or unvaccinated people be playing together? And the answer to that is, where do those unvaccinated kids go home to? Are they going to be around vulnerable people? And if they are, they should be masked. If you feel like you want to take the chance at spreading the Delta virus in your family, then okay, then don't go masked. But my recommendation would be, you know, it's always safer. If you have a doubt, you ought to be masked. It's a little like fly fishing. Now you think, how can COVID possibly be like fly fishing? Because you're watching your strike, and you're not sure if you have a strike, you're not sure if you have a fish on. And the old saying in fishing is, when in doubt, set the hook. When in doubt, that doubt right there, that's the reason to wear the mask, because you're not sure. If everybody's vaccinated, I'm pretty comfortable. If everybody's not vaccinated, I'm not so comfortable anymore.
You can always make a fly fishing connection, I think.
I can. Well, then start trying.
You're working those
shields
two
up, baby. I haven't done it this week.
I know. Get it all out.
We want everybody to live long and prosper.
Get it all out. Okay. So kind of similar on that. We have a blended family. I think 2 households. The household with the 12-year-old doesn't mask, social distance, or believe in the vaccine. We are vaccinated, so how do we protect our 5-year-old from their step-sibling when they go back over to that house?
Yeah, that's okay. There's a lot of dynamics in that question.
Yeah, right?
It's just COVID dynamic. I would say tell the 5-year-old to be masked, because the 5-year-old, whereas masking is more effective to stop you from spreading to someone else, it does offer some benefit to the 5-year-old to prevent him from getting it. So I think that's I mean, you really don't have a lot of other choices here. If the 5-year-old's going to go to that house and this person's refusing to wear the mask, the only choice you have is to tell the 5-year-old to mask. You're out of options then, up until, of course, the FDA says we can go ahead and start vaccinating young kids.
Okay, so I have this is kind of a 2-part question. about rapid tests and how accurate they are. I had a parent call me the other day after my kid had spent 2 solid days with her kid. She called me and said, my kid now has a fever, runny nose. I took her to the drugstore. We did a rapid test. She says, I don't know how comfortable I feel with those. If she keeps having symptoms, I'll let you know, and we'll go get a real test. So what are parents to do? They don't always feel super reliable.
Yeah, if they're positive, they're positive. If they're negative, it depends on the quality of that test. And so, if you're in doubt, you just need to do the old-fashioned swab. The rapid tests are better than they used to be, by and large, but you don't, without knowing which rapid tests they are and then pulling out the data from the FDA about how successful that test is, it's, nobody's really going to do that. That's just hard to know.
So should you bother even going and getting one, or do you have to?
Again, if it's positive, I think. And
okay,
so help, I think it helps.
But if it's negative, you don't really have that sense of security.
You don't have complete. It's helpful, but it doesn't give you complete security. What are you guys doing on the Olympic team in USA Track and Field, Vinsky?
Well, I think it's one of those things where.
And the Royals.
And the Royals, right. We do use rapid tests, but it's only in a pinch. I mean, if we need to know something right away, we need to have some data right away, then okay, use the rapid test, but they're still going to get the other test. And so obviously if we use the rapid test and they're positive, then we can isolate them. If they have a negative test, then we're like, well, right, but that's just a piece of data of the entire thing. Are they symptomatic? What are the other constitutional symptoms? It's just a piece of the puzzle if it's a negative until we get the real test to determine whether or not they're positive or negative. And I think that's the way we've been using it.
Dr. Ault, your thoughts?
Well, I agree. If it's positive, it's positive. That's really the take-home message. I was trying to think a little bit about pre-test probability. If you have a fever this time of year with COVID in the community, your odds of having COVID are pretty high. But we've got RSV and other things.
We do now
in the community right now, so it's muddled right this minute, I think, unfortunately.
Dr. Ault, what are you hearing with athletes in the testing situation?
So right now, a lot of what we're doing is intermittent PCR testing. A lot of it is being guided by the NGBs, and then right now the IOC. We did that again last month, going to the Pan American Championships. I think when I was there for the 10 days, I think we had a PCR test every 3 days. We had one before I left country. Obviously, we had one re-entering the country. But again, trying to stay ahead of it as much as possible. If there's any symptoms, it's just isolating the athlete right away from the other athletes, the other team members.
All right, so Dr. Ault.
Sorry, I got confused.
No.
Ault and all.
No, that's fine.
This is pretty good.
That's fine. No, we're getting all sorts of good stuff. Okay,
but your pre-test probability, that's a really good point.
Yeah. I mean, in an ordinary year, you can diagnose flu without a flu test. This is an extraordinary year, obviously.
Sure.
So.
Okay, so this person's asking, it's been 6 months since I was vaccinated. Do I need a booster shot? Am I at higher risk of hospitalization from the Delta variant? So, two-part question.
So there is a publication today in the New England Journal of Medicine that says you're still protected against the Delta variant from the mRNA vaccines. And so if you've received 2 doses. So the news is good. And there's some nationwide data, I think we talked about this last Friday, from Israel that kind of says the same thing, although it hasn't quite made it into the New England Journal of Medicine yet. So the news is good, basically, if you've been vaccinated. The question about boosters is really more of a research question. We need to do a trial where we give half the people who've fully vaccinated boosters and half the people not and follow them. That's going to take months. That's not an easy trial to do because you have to recontact a bunch of people who were in the original trial. But the companies are doing those trials, and eventually we will have data, but not next week, sometime before the end of the year.
All right, so this last question from Follow Up Friday is, we are older people and we are vaccinated, but is it safe for the 4 of us to ride in one car together and go to each other's houses with each other?
I think if you're all vaccinated and you're feeling good, right? Let's remember what all the rules are. You got to be feeling good, you're fully vaccinated, and you don't have a significant immunocompromise. You're not on medicines to suppress your immune system. You're not getting chemotherapy, things like that. Then I think that's a pretty safe scenario. So I would say, yeah, that's good, because that's the one group we know is still pretty darn safe. And I think that I would be comfortable with that. Now, there were a lot of quid pro quos in that. Did I say that right? quid quo, something like that. I don't remember. There are a lot of things. I put a lot of things on that. A few writers. It's kind of like that contract you get from the car company that says all the things they're not going to do. But I think that in this situation, again, if your age and if you are overall relatively healthy, the vaccination is going to really work well. We're seeing that coming out of the nursing homes. Patients are positive in nursing homes, but they're not coming to the hospital. Why? Because vaccination works.
Jill, do we have some questions coming in from the community today? I'm sure we do.
Thank you. I was muted.
There you go.
It's only been a year and a half, Jill. Don't feel bad. We still all do it.
Okay. We do have some that I think are kind of worth asking with this panel. One of them is, Carol wants to know, could you please tell us what are the symptoms of the people that are being hospitalized, not the ones in ICU, because they understand that they're really critically ill and might have other factors. What is bringing the COVID patients to the ER, and why are they being admitted?
Yeah, it's really the same thing. The initial symptoms are perhaps a little different with the Delta virus. It's actually more like a common cold, but then it's shortness of breath. I mean, the overriding thing is I'm short of breath. Sometimes it's terrible fatigue, muscle ache, joint pain, things like that. But the overriding thing that makes people be hospitalized is shortness of breath. And then they have what we see is they have COVID pneumonia. They also may have some of the other difficulties that come from COVID, but at the base of this is COVID pneumonia. You can get some heart failure, some GI problems as well, but really COVID pneumonia.
And Debbie wants to know if you could reconcile for her. She said it kind of feels like the FDA and the medical community have got mixed messages. FDA will not go ahead and grant full approval, and yet they're saying millions and millions of people have had the shot safely. Can you reconcile those two things for her?
We look at each other. I'm happy. I'll take on the CMO part of that. You take on the FDA part.
So the FDA is, and we want it this way, is strictly regulated by law. The Food and Drug Act goes back, to the beginning of the last century, and it gets amended. That's where the emergency use authorization goes to. So they depend on the industry people that are making the vaccine to supply them with data. And even though I talked about all the publications, the FDA might not consider all the totality of the data because they're authorizing a certain product from a certain company. So, that sounds restrictive, but, that's how we have done it for decades in the United States.
And just to say, the FDA is recognized really throughout the world as the gold standard for drug approval. And there'll be some people in England or in Germany or France that probably wince with that. But the reality is, I think, that is a fair and true statement, that if you look at how often we approve drugs that then turn out to be dangerous to people, it is exceptionally rare given how many drugs we approve and how many drugs are out there. So I think, occasionally you'll see them, you'll hear about them. I used to have a practice in pulmonary hypertension. There was a fen-phen. I mean, that clearly took a lot of lives. But the company hid the data. And so, if people hide data, it's hard to know. But overall, the FDA, I think, does a remarkable job. Now, we can all be frustrated they haven't given final approval, but what they've told us is, in a time of great crisis, we will take the information we have and grant emergency use authorization because we still believe the preponderance evidence shows that it's going to be helpful, which is what they've done in this situation. It's not the only time they've done it. They sometimes give pre-approval to drugs when there's nothing else that can be used, and they'll fast-track different medications because people are dying from some other disease. But in this situation, when you're going to say we're going to give widespread vaccination to millions, billions of people, and people around the world look to the FDA for its kind of stamp of approval, they want to make sure that they've got all their ducks in a row and safe. And God bless them for doing that, because I think they're doing it right.
Well, I think the other point I would like to make, for the people that work at the FDA and the CDC, sometimes we'll have evening conference calls to talk about agendas of upcoming meetings just to make sure the meeting flows smoothly, and, we'll have them at 7 o'clock Central Time. There are people on those conference calls that have to get off the call to get on another call on the East Coast even later. I mean, people are working weekends, evenings, and all day to get these questions answered that are federal employees. I give them a pat on the back. So certainly, they're working very hard.
Yeah, and I think those of us in a hospital, and when you take care of COVID patients every single day, and you're seeing how tired you all are, how tired you feel, and all that, what you really look at is to say, I just want to keep people safe. I want to keep people safe. How do we keep people safe? How do we? Well, we've done it. We've done it throughout the pandemic. We've managed to keep our staff safe in all sorts of hospitals around the country. How have we kept people safe? Because we follow the rules of infection control. I'm still astonished people don't think they work. You look at these hospitals, you say, our people who take direct care of COVID patients who are actively could be infectious, how are they staying safe? They wear a mask, right? It's not that hard. Think about this. It's actually not very hard, right? We don't like it. We rebel against it. We fight about it. But at the end of the day, it is an amazingly simple act. We're not asking you to pick up a 50-pound weight and carry it around all day long. We're not asking you to not go without food and water. We're not asking you to sit out in the sun and bake. We're not asking you to do things that are really going to hurt you. We're just asking you to do a very simple act. Shields up. Put a mask on. You can keep everybody safe if you do that. How hard is it really to keep each other? How hard is it really to keep each other safe? It's not hard at all. So even if you get worried about vaccination, okay, fine. I don't agree with you, but I think you should be vaccinated. But at the end of the day, it's a simple act to keep us all safe.
What else you got
Tristan wants to know, what is the data showing us with children under 12 years old getting hospitalized or sick with both variants?
Yeah, you know what? I am not the right person to ask. I think we have some children's folks back on Monday.
Dr.
So I think you should pull that conversation through to Monday and ask the Children's Mercy people about that. And or if Dr. Lauer was here, I think he'd be better. Do you have thoughts about that?
I mean, there have been thousands of children hospitalized with COVID. I would call Dr. Pahut if I had a question, so she is a friend and colleague of mine, so I would defer to her judgment. But, we looked at that when we looked at the 12 to 17-year-old emergency use authorization, and actually children get hospitalized pretty frequently with COVID, and since the Delta variant spreads more often, we had the potential to have more children being hospitalized with this disease. So there have been about 300 or more deaths in children due to COVID, and that's about twice as much as we have during an average flu season. So yes, it's a serious disease for children.
Yeah, tune in Monday. We're going to talk all about schools and more about kids.
And just a couple of more, and then I'm going to let you guys go. Jessica wants to know, on that note, what are the symptoms for positive COVID for younger kids, little toddlers, around 3 and maybe up?
Yeah, it's like a cold. And see, that's what's making it so hard to distinguish, is because if you think you have symptoms of a cold, it could easily be COVID. It could easily be the Delta variant. So a little cough, little sneeze, little runny nose. You know what? I don't know what you've got, because that could easily be the Delta variant. And that's part of the hardness right now, especially when all these other viruses are out in the community. And someday people far smarter than I am are going to write lots of papers about why did RSV and parainfluenza occur in the summer and not in the fall? What happened when we took our masks off that all of a sudden there was this big outbreak of all these other viral diseases? And so that's part of our challenge right now, is that all this other stuff is out there and COVID's out there. And, if you get a little sniffly, you think, well, I probably got one of these other things. I just got a cold. Yeah, maybe.
Yeah, that's what my mom friend said. She goes, oh, it's probably just a summer cold. But I was really proud of her that she got her tested anyway. Yeah, it probably is. But she still got her tested.
Nah, but you just don't know.
I'm going to give the last question to Isaac, because I think he probably speaks what's in a lot of people's hearts. He said, I was feeling good. I'm fully vaccinated. I'm going into restaurants and I'm eating. Now, after listening about the Delta variant, am I safe? Should I be doing that?
Yeah, you're safe. The question is, can you spread it to somebody else? Because the Delta variant can spread so easily. And that's really at the heart of the story. And we just don't know yet. And that's the other part of the story. And so then we see it spreading throughout this area, and we get really nervous, and we look at how full hospitals are, and we get scared, because we're like, man, if we have a lot of unvaccinated people, this Delta variant spreads pretty darn easily. People are getting together again. We need to stop the spread, because we don't have the capacity in the hospitals to take care of everybody. So from a very clear, that is clearly a CMO perspective, right? My perspective of the world is, how do we take care of people here at this hospital or any hospital in our area? And the answer is, we can't get overwhelmed. We get overwhelmed, we can't take as good care of you, no matter what your disease is, whether it's a heart attack, a stroke, cancer, or COVID. If we don't have resources to take care of you, that's going to hurt you. So our answer is, please help us break the curve, stay safe. So are you safe? Have you been vaccinated? You go, yeah, you're safe. But how do we keep our community safe? And we just don't know, I think, in the time of Delta. That's what I think the struggle is, Kevin.
No, I agree 100%. So.
All right, so much good stuff today. Thank you. This has been awesome. Great questions, great guests. I want to get some final thoughts. And Dr. Ault, I'm going to start with you.
So we have a public comments period during our meetings every time we have a meeting, and somebody said something very interesting during the public comments I hadn't really thought of. You know, we're on the cusp of flu season, and there's a new pneumococcal, new pneumonia vaccine coming out, and everybody should be up to date with those vaccines. We have some data from the very beginning in spring of 2020 that influenza and COVID together are not good, as you might expect. So, you know, so pretty soon we're going to be bothering patients to get flu vaccines, get up to date on their pneumococcal vaccine, and you know, we haven't seen a lot of flu over the past year because of masking and social distancing, and unfortunately we may have 2 or 3 things going on at the same time this fall. I hope I'm wrong. I would like to be wrong. So, but you know, that's on the horizon. So.
Thanks for all your great info today. We appreciate that. Okay, so I know it's a time of COVID, but Dr. Ault, Dr. Key, I'm very excited about the Olympics tonight. So just your final thoughts, Dr. Key, today.
You know, this is an exciting time for the country, for the athletes. I think the big picture here is obviously keeping them safe over there. Are there going to be cases? We've already seen that. Yes, there's going to be cases. Hopefully all the athletes, we've done everything that we can to mitigate the risks. But for me, especially with track and field, basketball, things of that nature, it's showtime. It's time to go. And hopefully these athletes can show what they have, do their best, you know, let the results fall where they may. But I think the big thing is that prayers and shout outs to the athletes, and hopefully they all come home safe. I think for me, selfishly, like I said, track is my big thing. Baseball is my big thing. Hopefully we can come out with golds, as many golds as we can.
Yes. Yes, well said. Okay, so Dr. Ault, you'll be watching. You're excited. I know I am. We all are. Just your final thoughts today as we kick off the Olympic Summer Games.
Watch the games. You know, at this point, just like Dr. Key is saying, it's go time. These athletes have been waiting an extra year, more than any previous in history. So they're ready to go. They're chomping at the bit. Let's try to cheer Team USA on, regardless of what sport it is. Watch it, enjoy it, and let's cheer our country on.
All right, let's do it. Thank you all so much for being with us today. Okay, so yeah, it's the kickoff to the Olympics, but it's also someone's birthday today. Someone is 39 again.
39,
Jill
holy
Chadwick.
cow.
Okay, so I did a frantic text message to Taylor, your beautiful daughter, this morning, and she sent in this great picture of you two. And so we wanted to share that, wish you a happy birthday. And I know Darren, your hubby, I'm sure is doing the same. I know you're getting lots of text messages today. And we just want to tell you happy birthday, right?
Should we sing for her?
I think
there we
there's
are.
Us channeling our inner Patrick Mahomes right before the Chiefs won the Super Bowl. All right, so I think we're just going to let Dr. Stites sing.
Oh my God,
I mean, why wouldn't we?
Happy birthday to you. Happy birthday to you. Happy birthday, dear Jill Chadwick. Happy birthday to you. Yeah.
Yeah, hello.
Thank you.
Happy birthday, Jill. We'll celebrate. I owe you a coffee and so much more, I know. Okay, forever indebted to you. Okay, so we talked about this. On Monday, Dr. Barbara Bahoud, back by popular demand from Children's Mercy, to answer your back-to-school questions. Also, Kenny Southwick, Executive Director of Cooperating School Districts of Greater Kansas City. He's going to join us to share some of the major struggles that districts are facing with infection prevention this fall, trying to get everyone on the same page. So we're going to talk all about that. We'll see you back here Monday. Have a fantastic weekend and cheer on our country.
USA.